Hello everyone, and welcome to today's webinar, which is titled From Policy Commitments to Effective Implementation of Gender-Sensitive Social Protection Programs. Next slide, please. My name is Raquel Tebaldi, and I will be the moderator of this session. Next slide, please. This is the sixth and final webinar in the Gender-Sensitive Social Protection webinar series, which is an initiative from the Food and Agriculture Organization of the United Nations and the International Policy Center for Inclusive Growth. In 2016, we held 5 webinars which presented a review of the evidence of the extent to which social protection programs have been gender sensitive and empowering to women and girls. The first webinar presented a review of current issues and policy trends in the area. The second webinar focused on rural women's empowerment in Africa. The third webinar looked at social protection design and gender-sensitive features in Asia. The fourth webinar was held in Spanish and focused on the financial inclusion of women in family farming. And the fifth webinar looked at gender-sensitive social protection in the Caribbean. In these sessions, we have highlighted the importance of care-sensitive social protection interventions and their importance for reducing women's time and poverty and improving their employment prospects and well-being. We also explored the benefits of linking social protection and financial inclusion schemes for women's economic empowerment, as well as the challenges in this pursuit. I would like to take this moment to thank all the panelists and participants from previous webinars, as well as everyone involved in the organization of the series, including the socialprotection.org team at the IPC-IG, and our co-organizers at FAO, especially Maya Gravilovic, who is presenting today, and Ana Paula de la O Campos. Finally, I would just like to highlight that all materials related to the series, including the slides and recordings of all webinars, have been uploaded to the Gender-Sensitive Social Protection online community at socialprotection.org. We are also publishing one-page summaries of each webinar in the series, and the first 2 are already available. So, next slide, please. In this final session, we would like to highlight and promote a discussion on what gender-sensitive social protection could look like, and what is the scope for its effective implementation. The first presenter today is Maxime Molineux. She's a professor of sociology at the University College. She served as director of the Institute of Americas at the School of Advanced Study from 2008, then moved to UCL as founding director of the Institute of the Americas. She was recently research director of a multi-country investigation into social protection, including the DFID-funded 5-country ODI project, Transforming Cash Transfers. Her latest publication is the special issue of the Journal of Development Studies, Can Cash Transfers Have Transformative Effects?, due to appear as a Routledge book. She is the editor of the Paul Gray Springer Series Studies of the Americas. Today, her presentation will discuss the feasibility of implementing gender-sensitive social protection programs in the context of current policy environments, particularly in Latin America. Next slide, please. Following Maxime's presentation, we will have the presentation from Maya Gravilovic. She is the social protection specialist working with FAO's social protection and gender teams. Before joining FAO, she has carried out qualitative research and policy work for various donors, including UNICEF, DFID, UN Women on social protection, maternal and child health, and child protection. From 2013 to 2014, she supported the government of Gambia to develop its first national social protection policy and implementation plan. She has published extensively on the subject, and her latest publication is titled Strengthening Coherence Between Agriculture and Social Protection to Combat Rural Poverty and Hunger in Africa, Framework for Analysis and Action. Today, she will introduce a new capacity development tool developed by FAO to guide social protection practitioners on how to integrate gender into cash transfers and public works. The tool builds on lessons learned from experience from different countries around the world. Next slide, please. Finally, our discussant today is Pamela Pozzani. She is the Senior Rural Sociologist working for Africa Service in FAO's Investment Center. She has led the qualitative research in FAO's flagship program from protection production. Excuse me. Conducting mixed method impact evaluations on cash transfers in sub-Saharan Africa, including studies on rural women's economic empowerment. She continues to contribute to FAO's Rural Poverty Reduction Program, with particular focus on qualitative research and policy advice regarding social protection and linkages with food security and nutrition, agriculture, and investments in gender. She will reflect today on the challenges that exist for implementing innovative program design, and explore the practical strategies that can be used to resolve these. So before we start the session today with the first presentation, I would just like to remind everyone participating that you can send your questions throughout the webinar using the question bar on the GoToWebinar application. So next slide, please, and I will give the floor to Maxine.
Thank you very much, Raquel, and hello everybody, and thanks to the FAO for inviting me to participate in this very exciting series of webinars. So I'm going to talk to you about social protection and gender, where we are now and where we might go, and also focusing a bit on Latin America to highlight some recent developments, particularly in the area of social accountability. So next slide, please. Right, so cash transfers are often seen, as we all know, as a magic bullet, but there have been limitations which have been pointed out by a variety of feminists and people who've done evaluations and identified some of the problems that still exist. Among them, the fact that cash transfers do help very poor people to cope with poverty, but they don't lift people out of poverty. And that is one of the kind of fundamental issues that affects women most directly, that we need to try to see ways to get women to cope, not just cope with poverty, but to actually get out of it. In other words, there are very few programs up until recently had any exit routes for the people benefiting from these programs via, for example, skill training. The other big issue from a gender perspective was the fact that the program, the ways in which programs are designed, depends to a significant degree on unpaid labor women. And there are problems about this can assist in deepening gender role divisions. Next slide, please. So in the first forms of adaptation to the needs of women, cash transfer programs tended to add a few positive features to assist women. For example, conditional transfers were given of children who were the main beneficiaries of these programs, and unconditional cash transfers given to elderly men and women meant that women could gain direct access to the cash, which is quite a significant development when considered cross-culturally. Also, there were aspects of maternal care that were provided, for example, postnatal health checks and prenatal health checks, nutritional advice and supplements and so forth. There were also, in some programs, including Mexican program, there were incentivized support given to girls, that is in the form of higher transfers to make sure girls did manage to get into school and did benefit from the programs. And a few cash transfer programs did have explicit gender equality concerns inscribed in their program design. Next slide, please. Despite adaptations to take account of women's vulnerability, it's widely recognized that gender remains a policy blind spot, and that in itself leads to program failure. I just include here, for those of you who can access the PowerPoint later, a couple of links to reports that show the failures that have occurred in policy design and more generally in terms of results tackling women's poverty. So there's clearly a problem here. Next slide, please. So let's have a look at the issues around gender poverty and inequality. Here we have a picture which, to me, completely and perfectly encaptures some of the kind of issues around gender-specific vulnerability and responsibilities. Children, domestic work, all in the context of very unsupported environments in which to carry out this kind of work. Next slide, please. Now, one of the problems, in fact, for me, a major problem, is the very little understanding there is in the policy communities, apart from those dedicated to gender, of gender relations. In other words, gender analysis is necessary. Gender analysis is not just about gender sensitivity, it's something much more comprehensive. And that's because gender is a fundamental principle of social organization, which underpins asymmetries and inequalities, which then become naturalized and essentialized. And that obscures the ways in which gender inequality is reproduced through all kinds of social processes, through state actions, through social policy, through social norms and institutions like the family and education and so forth. Now, that means that in general there is a lack of theoretical and analytic understanding of gender in development policy, which means that there is a lack of proper attention to the conditions that make women poor. Next slide, please. So gender relations are, in effect, the term we give to understanding advantages that affect men and women differently. The fact that women have fewer income generating opportunities, lower pay, care responsibilities, and so on, including maternal risk and harassment in the workplace and gender-based violence. Also, of course, in the home, girls and women suffer from hidden poverty. We call it secondary poverty. They have less disposable income, accumulate fewer assets, have fewer opportunities and less disposable time, due to domestic divisions of labour and authority. Divisions, I would say, that have changed relatively little in recent years. Next slide, please. So within cash transfer design, particularly in the conditional cash transfers, you find 5 assumptions about gender roles that are functional for meeting cash goals, but are not particularly functional for women's equality. So, for example, for mothers, children are seen as a primary role and responsibility. Mothers do not work, it is assumed, and child rearing and unpaid domestic work are not considered work. Program activities tend to be directed at improving and responsibilizing mothering, and giving the mothers the stipend seen as a more efficient way of delivering the money. They spend it on children's welfare, whereas the assumption is that men are irresponsible in this regard. So mothers get to be charged with fulfilling the conditionalities associated with programs. Health services entirely are directed to reproductive and infant health, and fathers scarcely figure in income design at all. Next slide, please. So, despite these things having been said many times over the last 20 or so years, if not before, there has been little responsiveness so far to these kinds of criticisms. But on the positive side, we are seeing some greater responsiveness, and I will focus my remarks here on the Latin American context. And I would also congratulate FAO for the work that it's doing in this regard. It's a really welcomed set of developments, as you'll hear in the second presentation. So just to run through this very quickly, what we've seen is more attention to financial inclusion of women, getting women hooked up into savings schemes that actually target women, such as Juntos in Peru. You've got also a range of cash transfers that are designed to promote and strengthen women's involvement in the labour market, and a range of other supplementary services informing women of their rights, for example, and giving women support for who are facing domestic violence. There are a range of other things, but next slide, please. Thank you. And here are a couple of examples that you can look at later in Chile, in Mexico, in Brazil, Colombia, and so forth, where you can see real efforts to have women involved in getting training and getting into the labour market with appropriate services laid on to assist in that. Next slide, please. And again, as far as progress is concerned in the area of childcare, relatively little in general, but there are some very good examples of things happening here. Again, very often to do with strong lobbying by women's rights advocates, and some responsiveness has occurred, in particular in Mexico with the Estancias Infantiles program, also in Chile, the Chile Crece Contigo big program, and in Brazil, the Brazil Cariñoso program, which provides public childcare to extremely poor households. So some progress there. Next slide, please. Now, there are problems that remain, and that is well known, I'm sure, to all of you. Most women still lack access to social protection, and in Latin America, the average proportion of women in poverty compared with men has risen, and this relates to the point I made before about the slow progress in addressing women's vulnerability, even in programs. And there are a range of issues, particularly underinvestment in services, including training and childcare, and I will stress very strongly the importance of reproductive health service, which are inadequate in most cases. Reproductive issues are a major source of risk, especially to poor rural women. And now, of course, we have in parts of Latin America the Zika virus. We have a fairly extensive spread of STDs and so forth, all the more necessary to focus on this issue. Even where women are included in social protection schemes, again, we find that they fail to address gender vulnerabilities in their policy and program design. And I want to come on to the next part of my presentation, which concerns the last point here. Next slide, please. That women lack voice and presence in program design. Next slide, please. So, accountability is the name of the current concern to incorporate more voice and more presence of people who are beneficiaries in social protection programs in order to improve program design. And here are a couple of definitions. Next slide, please. Thank you. The idea is that social accountability and a social responsibility will foster citizenship and responsiveness. The idea is if you get people to be involved in holding service providers to account, this will enable citizens to influence public decisions, complain about corruption, complain about discrimination and poor services, which is, of course, a big problem in many parts of the world. Also, the idea is to incorporate these forms of social control over policies across the policy cycle, all the way from design, implementation, and so on, so that there's a voice incorporated from those who are at the receiving end of these policies to be able to improve them. It's a very important idea here, and I think it deserves serious attention. Also, this is not just about participation and social accountability at local level. This involves moving up the sort of chain of responsibility to the highest level, incorporating also meso-level and macro-level discussion with those who make decisions to hear the voices of the poor themselves. And finally, key issue here is transparency, that programs must be more accountable through making the ways they operate, the budgets they operate with, more available to both those who are the beneficiaries, but also to other actors, for example, the media, lawyers and so forth, to access the information in order to investigate claims of corruption and diversion of funds and so forth. Next slide, please. So just a few examples of social accountability and social protection at project level. You all, I'm sure, have done PM&E, participatory monitoring and evaluation. That's very common these days, but also other forms like community scorecards, complaints monitoring through free phone-ins, Citizens groups representation, such as occurs in Brazil with Bolsa Familia, where beneficiaries are represented on popular councils and can make their complaints at that level. And of course, finally, very large-scale social audits like in India, Pakistan, Philippines, and so forth. Next slide, please. Now, the expected effects of social accountability are quite optimistic, that there will be democratic outcomes, that there will be more program and policy effectiveness, more citizenship empowerment, and, next slide please, state responsiveness. Does this actually happen? Well, it does, but there's no hard evidence yet, partly because the research hasn't been done on a sufficiently wide scale, but it does look as if, on the basis of what we know, these measures have helped to reduce corruption, improve service quality, and empower people, sometimes with citizen effects. That's to say, people become more aware of their citizenship and their responsibilities and their rights. After all, complaining is about expectations. Next slide, please. So when we come to look at women and these new forms of participation and accountability, we know from the evidence available that gender norms restrict women's participation. Women are afraid to complain, they're afraid of retribution, they're often not allowed to participate in these spaces by partners or others. And the costs to very poor women can be very high in terms of time involved in participating, traveling to these sites, and of course caring. What do they do with the children while they're doing this? And participation must deliver something. It can't just be an empty space that people talk in and nothing happens. Now, unless these factors are taken into account in design, we won't see social accountability working for disadvantaged women. So it is important to take these factors into account at design stage and all the way through implementation. Next slide, please. There are some interesting and positive examples. We found research on indigenous women in Mexico, and our own research in the Andean region of Latin America shows that poor treatment of beneficiaries, for example, common cases of clinics being closed when people arrive for their services, long queues, when they're collecting the transfer, up to 7 hours we found in the hot sun, long travel times, and of course racism against indigenous people. These things were, at least to some significant degree, altered after indigenous women were made aware of their rights and demanded respectful treatment. Again here, found a shift in the attitude towards the transfer once they understood things much better, from being one of gratitude to the president for giving, for example, the transfer, to a sense that it was their right to have it, not something they owed loyalty and to a particular government for. Next slide, please. So one important point about this issue so far that's emerging from the research that we have done is social inequality is a major obstacle to participation and to social accountability. And we cannot just rely on beneficiaries of programs to participate, because that risks failure in very deprived social contexts for some of the reasons I mentioned earlier, and of course to the exclusion of women. It's not enough just to say, come and participate. You need to have a close attention to the frameworks, the way that social accountability measures are set up, in order to make sure there's transparency, people understand the program, to make sure that women's representation in these social accountability spaces is secured and is carried out in the way that I mentioned before, with due attention to their constraints. And of course, things like expecting the proper conduct of officials in these contexts, all these things have to be built into program design. They don't just happen automatically. Next slide, please. So we would say in conclusion about social accountability that it can bring some positive changes. It can bring about at subjective level, at community level, and at institutional government level some important shifts in the way people think about histories and about policy delivery and design. But this does depend to a large degree on politics and rights. It depends on the nature of states. It depends on how citizenship is exercised. Again, it can't just happen automatically. It's very context dependent. One very important factor is the more targeted programs are, the more likely they are to stigmatize and disempower receiver groups. So universal or universal delivery of services to poor people works far better and has much greater citizen effects. Next slide, please. So, conclusions. In regard to social protection and gender, we've seen some very welcome advances in thinking and practice, but these are highly contingent on external factors. For example, elite commitment to effective, sustainable social protection can be very variable, so it depends again on pressure to keep elites aware of the importance of this, this form of delivery. There is a context now of donor funding shrinking, which we're all very concerned about, and economic conditions are pretty uncertain. So, and of course also a limiting factor is that transformative agendas, for example, around gender and citizenship are actually political and can be perceived as threatening by conservative power elites. But having said that, we have to keep going and keep pushing for more progress in all of these domains. Thank you very much.
Thank you very much, Maxine, for that excellent presentation. Now we move to Maya's presentation. Maya, over to you.
Thank you very much, Raquel. Good afternoon to everybody. And I'm very excited to participate in this event and have the opportunity to share the floor with our IPC colleagues and two amazing women and gender advocates such as Maxine and Pamela Pozarny. In this presentation, I will cover three topics. First, I will briefly introduce FAO's training materials on gender-sensitive social protection programming that we are currently developing. Then I will discuss in some detail how gender can be integrated into a design of cash transfer programs. And finally, I will present the case study example of the pilot in Egypt in the urban suburbs of Cairo to illustrate what sort of innovations in design can actually look like in practice. So let's start with a very brief overview of FAO's training course. First of all, this course is being jointly developed by gender and social protection teams at FAO. So can we please move to the next slide? Now, in terms of why we have decided to develop a training course, there are several reasons. First, over the years, FAO and our different various partners, including ODI and IDS and UNICEF and the World Bank, have worked on establishing a very solid knowledge base on the linkages between gender and social protection. And there are also important experiences from countries that have expressed a sort of growing commitment to integrate gender into their social protection programs. But despite this progress, there seem to be significant sort of capacity deficits which remain to actually design and particularly implement gender-sensitive schemes effectively, and this sort of leads to missed opportunities to tackle poverty inclusively and sustainably. Now, we have also found out that there does not seem to exist a sort of training course that is exclusively devoted to this topic, so we wanted to fill this gap. In terms of the purpose of the training, we would like to provide guidance to social protection practitioners on how to effectively integrate gender lens into cash transfers and public works schemes. The scope of the training is very much based on FAO's expertise in rural poverty reduction. So, well, first of all, we focus on the whole program cycle, and we look at how gender can be integrated and inform the sort of different stages of the program, from planning, design, implementation and monitoring and evaluation. We focus on rural poor working in agriculture and non-farm rural economy, because this is one of the areas that has not been sufficiently, we think, explored both in the literature and programmatically. And then based on FAO's expertise in social protection, we wanted to focus on cash transfers and public works programs because of their relevance to the poorest and most marginalized farmers. In terms of the target group, we hope that the training will cater to FAO staff, as well as program designers and managers involved in administering social protection schemes. And so far we have developed 3 modules. They're interrelated, but they can be also used as standalone materials depending on people's interests and experience. Let's move to the next slide. Thank you. So I will very quickly run through the topics that are covered in these modules. Now, our first module is really an introductory module, and it introduces the rationale for considering gender in social protection. It also explores how gender, discriminatory gender norms and gender inequality, how they affect women and men's and girls and boys' experience of poverty and vulnerability, and how it shapes the coping abilities to respond and manage various risks. And then we look at how the existing programs address gender dimensions of poverty and vulnerability, and we explore this both in terms of providing the sort of overview of the evidence of impacts that have been documented to date, but also look programmatically at how different programs and different ways and the extent to which they consider gender in their design. Can we please move to the next slide? Now, in Module 2, we discuss why it is important to undertake a gender-sensitive poverty and vulnerability analysis, and we provide some guidance on how this could be conducted. And then we delve deeper into technical discussions on how to integrate gender into a design of cash transfer programs and then public works programs. And here we sort of organize our discussion by looking at different core design features that are relevant to each policy instrument. And here I list these core design features relevant to each measure. And we will come back to discussing the way this is tackled in cash transfers shortly. And then in Module 3, we focus on a very important part of the gender-sensitive social protection that sometimes gets neglected. So we look at what are the sort of key dimensions of gender-sensitive implementation of social protection programs, and how we can ensure that the commitment to gender-sensitive design provisions can actually be effectively managed in real life. So first of all, we look at the importance of the basics, in getting them right in terms of ensuring predictability and regularity of transfers provided to beneficiaries. And then we look at the importance and the role of the political commitment and how this can be fostered towards gender equality. And then we look at the staff capacity that is needed to implement the design. And we look at technical skills and incentives, and then the financial resources that are necessary. And finally, we also include a section on gender-sensitive monitoring and evaluation. Can we move to the next slide? I sort of have to highlight that our training materials are still very much in progress, and we hope to finalize the drafts in the next 2 to 3 months. So let me now go back to this issue of how gender issues can be better integrated into a design of cash transfer programs. And here I will talk about all core design features that are relevant to cash transfers, including program objectives, targeting, size of benefit, sensitization and messaging, as well as the linkages with complementary interventions. Can we please go to the next slide? Now, developing gender-sensitive program objectives is kind of an obvious and important step starting point in program design. And here we sort of think about a basic argument that all programs should work towards equality, and this is what Professor Maxine also argues so well in her work. Now, there are two options available to do this, depending on other program objectives that programs try to adopt. Now, first, even programs do not specifically aim to reduce gender inequalities or empower women. At the very minimum, cash transfer programs must not violate women and men's rights. And programs need to ensure that its outcomes are gender equitable. In other words, that women and men equally benefit from the scheme. But there is also, some programs may explicitly aim to reduce gender inequalities and empower women and girls, or men and boys, where this is seen as essential to achieve the main poverty reduction objectives. So, for example, in Mexico, Prospera, one of the primary goals is to reduce gaps in girls' access to secondary education. And then, a little bit more rarely, there is another in Brazil, and I dare not address the name of this program. But this program is explicitly designed to economically empower women and enhance their employability. But I think there are different views on whether gender equality and particularly goals of women and girls' empowerment should be a stated objective. But I think this raises the importance of the gender and vulnerability analysis, which should always be used to inform the formulation of objectives and priorities. Can we move to the next slide? Another critical feature of gender-sensitive social protection is targeting. And here we sort of claim that eligibility criteria used to identify the beneficiaries, as well as the targeting methods, such as means testing or community-based targeting or categorical targeting, should be gender-sensitive. I personally find targeting to be quite a complex process from a gender perspective, but essentially I think this means that approach needs to ensure equal access to programs for both women and men, but sometimes this may entail giving a preferential access to people on the basis of their greater poverty or vulnerability status. So let me try and illustrate this with examples. Some programs target women as beneficiaries on the basis of their greater vulnerability and exclusion from resources and opportunities. So, for example, cash transfer programs can target female-headed households, or social pensions may target widows. And these approaches seem to be usually politically acceptable. However, the problem from a gender-sensitive perspective is that they may sideline the very vulnerable women who reside in so-called double households with males as household heads. And this may include women in polygamous marriages who may also need special assistance. Then there is another targeting approach which is often adopted in cash transfers, which targets poor households as a unit. And this usually means that resources are channeled through a household head. And one of the major challenges with this targeting approach is that it doesn't pay attention to intra-household gender dynamics enough and how these impact individuals' access to and control over benefits. So there is an example in India which is very interesting that tried to sort of address this downside. The Universal Basic Income Grant, which was piloted in Madhya Pradesh, sort of provided individual entitlements to each member of the household to ensure that everybody benefits equally. And so far, there is some evidence that this is actually working quite well. And then there is also an approach that Maxine has discussed, which is very relevant to conditional cash transfers and which usually target vulnerable children. But women as primary care providers are typically the ones who receive the cash. And this is based on the rationale that women are perceived to spend cash in a more child-friendly way, and having access to money can be empowering to women. But there are challenges with this approach as well, because it may reinforce gender stereotypes regarding women's role as a care provider, as well as expose them to risk of gender-based tensions and violence at home, as well as exacerbate the time poverty and interfere negatively with productive activities. Another downside is this belief and this assumption that targeting women will automatically lead to empowerment, and I don't think that evidence actually supports that. So there is an argument to be made that other measures may be necessary to address constraints that women face when using cash, including sensitization or training on rights and other activities. Can we have the next slide, please? Also, the size of the benefit is an important feature that can be adjusted to tackle gender vulnerabilities and inequalities. And in Mexico, the Prospera uses cash, which is conditional on school attendance for all children. But beginning at the secondary level, the grants are slightly higher for girls than for boys. Now, there is also some limited evidence which shows the benefit size has implications for gender relations and gender equality outcomes. On a positive note, larger benefits can help women and men, of course, meet their practical needs, enable productive investments, and redress some asset inequalities, as well as improve women's position and bargaining power within a household. But at the same time, changes in women's status and access to cash may cause tensions between spouses. And I think in Bolsa Familia program, there was a study done which identified links between women's increased income coming from the conditional cash transfer with an increase in experience of violence. So these trade-offs need to be carefully considered as well as monitored. Next slide, please. Now, conditionalities, I mean, there is an extensive debate about whether conditional cash transfers are justified or not and whether they work. And I will not enter this discussion here, but I would like to explore how program conditions, if these have to be adopted, can be designed in a gender-sensitive or even a transformative way. And we have identified several options to do this. First of all, programs can broaden the types of conditions to address different gender vulnerabilities beyond its traditional focus on education and health. So, for example, in Ghana's LEAP, conditions applied in the program relate to reduction of harmful gender practices, such as hazardous forms of child labor, which predominantly affects boys, child marriage, which is something that very heavily affects adolescent girls. And another condition is related to birth registration, which is exceptionally important for both boys and girls in terms of removing barriers to accessing social services later in life. So the transformative conditionalities it can also be ensured by sort of monitoring the effects of conditions on women's work burdens, their time poverty, and changes in intra-household dynamics and roles, particularly looking at the impacts of conditions not only on adult women, but also girls or elderly living in the household. Program designers can also consider putting safe and transparent grievance systems in place to document the risk of unofficial conditions that may get imposed on beneficiaries. And I think there was some documented examples in Peru, Juntos program, where women beneficiaries were sort of suffering some extra conditions imposed by local project managers. And this was very much linked to the position of sort of marginalized position and limited voice and agency to negotiate this situation effectively. And finally, from a transformative agenda point of view, conditionalities, the programs can encourage a shared responsibility between spouses for fulfilling the program requirements, as it is, I believe, happening in Brazil's Bolsa Familia. Next slide, please. Sensitization and messaging is another relatively simple and low-cost strategy that can be used to promote gender equality and particularly sort of work to address discriminatory gender norms, roles, and relations. And there are many options available depending on what the program is trying to achieve. At a very basic level, the sensitization and messaging can be used to promote women and men's equal access to and use of the cash transfer, or even promote the idea that cash can be used for women's income generation, as it is happening, I think, in Ecuador. It can also, sensitization and training meetings can be used to improve women and girls' awareness of their rights, as well as meetings can be used to engage men, boys, village elites to raise awareness of women and girls' rights and the importance of gender equality not only for women but for families and ensure the support for the program. And this approach is adopted again in Bolsa Familia through the collaboration with Promundo. And Promundo has developed a training course to address and prevent the perpetuation of traditional gender norms and potential sort of escalation of violence in the program that targets women as main recipients of cash. And through these trainings, participants were encouraged to critically reflect on shared decision-making and power dynamics within their relationships and the importance of women's empowerment for poverty reduction. But what we need to sort of highlight is the sensitization and messaging activities should be designed and delivered in a culturally sensitive way. Next slide, please. And the final design feature that we discuss in the training is how to link cash transfers to complementary programs. I think that there is a sort of common understanding that cash transfers or any social protection measure on its own cannot really tackle all dimensions of poverty and resilience. Resilience to risk. And this also applies to gender-sensitive social protection programming. So this highlights that cash transfers need to be integrated with other interventions to address multiple dimensions of gender poverty and vulnerabilities, and in this way promote more sustainable poverty reduction and gender equality outcomes. And once again, I mean, there are various options for how cash transfers can be linked to complementary measures. Something that we very much focus on in our work at FAO is looking at how cash transfers can be synergized with access to productive inputs and nutrition training to promote food security and nutrition. And in Lesotho, for example, FAO has joined forces with the Child Rights Program to pilot the linking the food security with social protection scheme, whereby the beneficiaries of the program, who are mostly women and children, receive food and training how to grow their own nutritious food and sort of adopt some climate smart practices when they produce and grow their own food. Cash transfers can also be linked with healthcare services, health insurance, and childcare services to address women's and girls' care burdens, or to promote income-generating opportunities and asset accumulation. More and more program designers are exploring the possibilities of linking cash transfers with productive support and financial inclusion, such as credit, access to credit and saving services and business development. And this is happening in Ecuador within Bono de Desarrollo Humano program. Finally, cash transfers can be linked to transformative measures, including rights awareness and legal literacy training and anti-discrimination legislation to strengthen women's social status and reduce vulnerability to social risks. But of course, type of complementarities depend on the availability and quality of services, which are often sort of lacking or of limited quality in rural locations. Of course, complementary services that are linked to cash transfers also need to pay attention to gender barriers to access and using these services well. We should also highlight that participation in multiple programs, while it's beneficial on so many levels, can also potentially overburden women in terms of time and costs incurred to participate, or it can also exacerbate potential alienation of men and other community members, and in this way sort of contribute to gender-related conflicts at household as well as community level, which underscores the importance that the effects of multiple participation on women and men need to be carefully monitored. Next slide, please. So very quickly, let me illustrate some of the issues that we have discussed regarding gender-sensitive design provision through a conditional cash transfer program in Cairo, the Ain al-Sira pilot in Egypt, which includes many of the innovative design features that promote simultaneously household poverty reduction, the promotion of human capital of children, and women's empowerment. And this program was launched in 2008 in 4 slums of Cairo, and I think it has been delivered to approximately 165 households. Now, the pilot adopts the explicit dual goal of promoting children's human development and women's empowerment and citizenship rights, and the focus on social justice is prevalent throughout design. Program was designed through participatory planning process, so feminists and academics both from Egypt and globally have come together to develop a first draft program design document, and this was then shared with NGOs, social workers and poor women, the potential beneficiaries, for their views and comments, and based on that design was revised. In terms of the targeting, the pilot targets ultra-poor households, and the main target group are children, and women are recipients of cash. But the program has also, through communication and sensitization activities, tried really hard to reframe women's roles in social protection, not only as care providers, but also as productive actors, and most importantly, citizens with social and economic rights. In terms of conditions, cash was provided also as the formal entitlement for reproductive work that women do, and this also included some extra compensation to women for spending any additional time on fulfilling program conditions. Next slide, please. In terms of the grievance mechanisms, the program employed self-monitoring tools to enable women to monitor their own compliance with conditionalities, and in this way avoid a risk of a social worker gaining too much top-down control over the information on compliance. And I think indirectly this is also was seen as a way to sort of empower women and increase the status and self-confidence in dealing with authorities. The program was paid through, the cash was paid through bank accounts, and this gave women a sense of security and opportunity to save their money and promoted their financial inclusion. And in terms of the sensitization, monthly sessions were organized to promote awareness on citizenship rights, housing, reproductive health rights, as well as to facilitate networking and collective action among women to empower them to challenge some of the traditional discriminatory patriarchal norms and customs. And finally, complementary services, access to credit, skill development trainings were provided to women to promote their financial inclusion and economic advancement. And the pilot was launched, as I said, in 2008, and based on the positive outcomes that were documented through evaluation of the program, the pilot was scheduled to be expanded from urban communities in Cairo to rural locations across Egypt. However, in 2012, it was put on hold because of the social unrest in the country. So I'm not really sure what is the current status of the program, but if you would like to find out more, I mean, there are many references about the program on the web, including the result of the evaluation, and I'm also happy to share some. So let me just finish with very few brief points about the next steps for FAO. We would like to pilot the training in 2 to 3 countries, hopefully in different regions, starting with Sub-Saharan Africa and South America. We would then like to use the opportunity of the piloting to document the specific sort of country-level experiences in gender-sensitive social protection programming, and based on that, update our training materials with the current practice from the field. And then we would like to support national governments in designing a specific social assistance scheme in a more gender-sensitive way. And we hope to keep you informed about these developments in the future. Thank you very much.
Thank you, Maya, for that excellent presentation. Before we move to Pamela's intervention, I would just like to remind all the attendees today that you can send your questions to us via the chat bar, the questions area of the GoToWebinar, and we will be addressing them in the question and answer session at the end of this webinar. So now, Pamela, over to you.
Okay, hi everyone. Thank you for this opportunity. I'm actually delighted to be able to share insights on the first 2 presenters, but also very much the insights and some synthesis lessons that we've kind of garnered from our in-depth qualitative research out of the Protection to Production, the P2P project in FAO that's been ongoing for several years in a number of sub-Saharan countries. So I'd like to talk about the challenges and the barriers, particularly in practice, on the ground, in villages, in local settings, in communities, and then also talk a little bit about how that links to and what the enabling environment at the national level and the impacts and the effects of national level policy, legal instruments, how that affects the gender-sensitive, gender inclusion in social protection programs, particularly cash transfer and public works. And then talk about the program project design features, the operational aspects, and talking from the experience and the evidence that has been generated from P2P, whereas Maya is discussing sort of the training program that's very much based on the evidence, but I'd like to just share some of the insights about what we've learned from the modalities of project and program implementation and design, and then the suggestions to improve those aspects in relation to gender inclusion and gender mainstreaming. Okay, so in terms of the local context, let me say that throughout our case studies, we have now about 10 qualitative studies throughout sub-Saharan Africa, and inevitably we hear about the sociocultural, traditional beliefs, norms, perceptions of gender roles and responsibilities. And so as much as cash, even given directly to the woman, the wife, the mother of a household, as Maxine has brought out very clearly, it does not necessarily imply gender, any form of gender empowerment or agency. The assumption has to be really studied and defined, because the social cultural norms are so prevalent and are really the rules of the game in these villages that doesn't really make a huge difference. And it's in the household, and it's also in the community-wide. These are also buttressed by lineal systems. The actual patrilineal system or matrilineal system does not necessarily imply women's gender equality or women's empowerment. In fact, the cash transfer or conditional cash transfer, as it may be, as Maxine I think mentioned, can actually reinforce and harden or cement traditional gender norms. Particularly around conditional cash transfers, it is in some cases just reinforcing what the assumed woman's role in a household would be. So it doesn't necessarily imply, again, any form of improving the gender equality landscape. Also, we heard quotes like, women get the money and then they make the decisions, but for the household tasks, because women just do it better. It's these perceptions of that's the norm, that's just the way it is. Women should not earn money. In fact, in some countries we heard that women with money, then they must be prostitutes. So there's actually a whole mindset about putting cash in there's a sensitization that is required. Putting cash in the hands of women may actually imply certain negative connotations. As was mentioned, women, even if a cash transfer goes to the hands of women, it doesn't mean that they necessarily are the decision makers or have control over that resource. Let me move to some findings about our study on public works, on women's economic empowerment in terms of a public works program. And one of the very telling quote that we heard is that women cannot actually afford to work. So what does that mean? There are time constraints. There's a balance amongst a number of responsibilities and roles. There's workloads. There's the farm work. So even if it's under a targeting situation, or even if women are targeted to participate, they actually cannot even afford to spend that time to engage in a public works program. They have too many other responsibilities, or if they do, they may have serious implications on household labor dynamics. It could result in actually child labor as the woman of the household is working. So one needs to pay attention to these kinds of aspects. It also, even though income generating activities may be promoted slightly with more cash in the household, that also is a question of balancing the care work that women are responsible for. If income generating may take time, may take labor, then that may pose problems. for the household and for the women. So you can see that there are a number of implications by assuming that you just give women these opportunities in social protection programs. It needs to be very much thought through. And that will take me into the design and some strategies about improving some of these programs in terms of design and implementation. Let me just mention also that in trying to develop strategies and gender sensitive social protection, social assistance programs, I think the political commitment is very important. The enabling environment, the strategies, the champions in government. There may be a Ministry of Gender that's very vocal, that's very active. These can be very positive and catalytic features that may really affect the design and the implementation of social protection programs. So the political commitment, I would argue, is important, and that's along the as well, and that it links up with the policy environment and the legal measures and the legal instruments that are in place. At least they are there at a higher level that give the environment a favorable environment with which to work and move forward on this agenda. Now let me talk a little bit about operational aspects of an actual program. What are some of the strategies or the measures that could be taken on board or are worth thinking about from the lessons we have learned from our work? As been mentioned by both the presenters, gender analysis is critical. And that's not just a theoretical or an analytical, but gender analysis of everyday lives, of everyday people in the villages, in the rural households, and particularly of those most vulnerable. You know, what are the livelihood strategies? What are the gender balance of roles and responsibilities? You know, a whole gender analysis along with livelihoods and vulnerability analysis together is just critical to start working on developing a design. Consultation along or included in that gender analysis is critical. Consultations at all levels, including very much at the local levels, with a wide range of stakeholders, men and women. Then the actual composition of the team, of the design team, and I liked what I think, I'm not sure which presenter discussed how, I think it was Maya in the Egypt example, that the design team and those who are actually strategizing to pull together the actual operational modalities of the program, that's important. Are they gender sensitive? Is there a gender balance in that team? These are important questions to ask. Now, getting into the some of the design features, it was mentioned about sensitization and training, and even upstream of a program, sensitization of policymakers, of the ministries and ministry staff who are overseeing and supervising this program, certainly of the staff who are at central and particularly local levels, sensitization and training about the program, about gender mainstreaming, gender equitable issues, and the impacts desired or foreseen from this social assistance program. I think it's very important to sensitize local authorities, service providers, and certainly, and almost perhaps most importantly, is the local committees that are actually doing most of the groundwork, the messaging, the payments oftentimes, and the household support to be sure those local committees are preferably gender balanced and also very much gender sensitive and have the knowledge, the understanding of the importance of gender sharing and gender equality. The content of those kinds of sensitization and training programs should be about both intra-household dynamics, but also community-wide. So we've talked about the voice and representation and agency. So that's at the household level, but also at the community level. A critical aspect I haven't really talked about yet is the importance of timely, regular, reliable payments. Whatever that may be, at whatever frequency that may be, this is critical. It is very critical for women who may be on the verge of risk-taking with a little bit of cash. Maybe they can start investing in a small petty trade, which many we have learned do. But and some of them actually take out small loans, and it may be just a loan from a neighbor. But even doing that, or a shopkeeper, the reliability of reimbursement and paying back is critical. And they and the person lending to them are relying on the payment from the cash transfer, let's say. And so it is vital that that transfer is predictable, because it's actually a form of risk-taking on behalf of these women. And again, whether it's through a merry-go-round or an informal village savings and loan, which many have evolved because of these social assistance programs, or if it could be through a microfinance institution where they may come together and take out loans. The fear of falling into debt is very, very high, and it's one of the main reasons why many women do not engage in taking out loans or credit. But the cash transfer allows them, opens up the opportunity, but the payment will be regular and predictable. The other point about implementation, let me move on to another critical point, is the linkages. So that's been discussed particularly by Maya, and we have found that the overlapping of different types of support to these households and to women in particular can be very incentivizing and motivating for women to move forward in terms of economic empowerment and even social empowerment, whether it's through the Ministry of Gender, such as in Rwanda, who promotes mothers clubs, where women come together and talk and share and build confidence, and eventually start perhaps sharing village savings and loans type of credit sources and such, or other types of social networks. Of course, linkages with the agricultural services, vocational training services, trade, value chain, perhaps training in processing and developing other trade and small businesses. These are all opportunities provided by social assistance programs, and can lead to eventual leaping out of poverty, as Maxine talks about, which is almost graduation. The linkages are just vital for that. And women who can be so entrepreneurial, we found so many wonderful opportunities, for example, in Kenya, of beneficiary women getting together and putting their money together and opening up shops, developing petty trade, or even starting a small motorcycle group. You know, there's great opportunity, but the linkages will help stimulate that. The payments must be fairly regular, and the support from the program should be viable and also very, very regular. Finally, I just want to mention that monitoring and evaluation of programs, including impact evaluations, are critical. They not only help monitor aspects like, for example, in public works, the amounts of payment, the amounts of days work, so that women actually see that the balance and the rate of return for investing their time in public works is worth it. And so maybe they can start affording to do public works because they're working enough days with enough payment to balance up and to benefit. But also the monitoring and evaluation, and particularly impact evaluations, also provide really in-depth, insightful, ongoing analysis of the impacts of how are we doing as we're going along, particularly regarding gender equality and women's empowerment, and then taking those lessons, obviously, and feeding them into ongoing or new design programs, new designs of programs in the future. So these are just, I think I'm running out of time, some ideas and some trying to hit the lower fruit of what we have found to be critical barriers, and some possible strategies and measures, particularly in programs themselves, to kind of improve slowly the programs on the ground of social assistance. Thank you.
Thank you very much, Pamela. So now, adding to these points that Pamela has raised for discussion, we have received some questions from our audience. I'm going to direct these questions to our panelists in separate rounds. So for the first round, we received a question relating to the context of South Africa, specifically the Child Support Grants Program, which gives money to the carers of children in low-income households. In this specific program, women and men are eligible to receive these transfers, but only around 2% of the total number of claimants are men. So, to all the panelists, do you have any thoughts on how to improve male uptake without this becoming a male rights issue and without undermining the empowerment that we know has arisen from women receiving the cash? A detail which this participant has added is that the qualitative work that he has conducted with male recipients indicates that they perform a large care and household work. The second question is the following. Are there any examples of projects that have provided unconditional transfers directly to women, but instead of this unconditional cash treated as payment for their unpaid work, for instance, care work and home responsibilities? And if so, what have been the results of this? Mainly, she's referring to the impact on women, social norms, and position within the household and community. And the final question is directed to Mike, but I guess Maxine and Pamela can also feel free to share their inputs. Apart from giving money to all family members, do you have any idea what is an appropriate approach to balance women's and men's power in cash transfer programs? How can a project target women without tensions in a household? Are there any gender training for men to understand gender equality together in cash transfer programs? Maxine, you can go first, and then we give the word to Maya and then Pamela. Maxine, over to you.
Thank you very much. Do you want me to address all three questions or just the first?
Yes, Maxine, please feel free to address all three.
Okay, thank you. Well, they seem to converge on a central issue, which is the question of, on the one hand, giving the cash transfer to men and women together has the possibility that it may end up in the hands of men or do different kinds of problems. On the other hand, we want to see greater involvement of men in a responsible way in the household and in issues of care, issues of domestic involvement, and also particularly with regard to children. And I think that it is possible, but it doesn't happen automatically. And I think programs which are trying to do this to make, as Maya mentioned, greater shared responsibility for the household in terms of its domestic arrangements, need to be thought about very carefully. And of course, depending on the context, you know, you find more or less favorable conditions for doing that. In some contexts, it's less favorable, and we know from research on the Middle East that it's quite difficult to allow for women to be allowed control over the cash transfer. So there are questions here that I think we need to look at in their specificity in terms of the cultural context. There isn't a sort of simple answer, but certainly programs do have a responsibility for assisting in getting men more involved in the program, in the talks, in the discussion about child nutrition, child health, education, and so on. Just by allowing men to be there and participate and expect them to be as interested as women is already a step forward. As far as the child grant, I don't doubt that there are men who do take on responsibilities of care, and we need to be more vociferous and more public in their commitments, and more supportive perhaps also of programs that are actually trying to change gender relations. It's a terrific program, the South African Child Support Grant, and it's done a great deal for children and households, and I think there's much to recommend it. But at the moment, with only 2% of claimants who are men, we can see that there's still a huge gender differential in terms of the norms that dictate that allocation. I think I've covered most of those points. I'll leave the third one to Maya to answer.
Thank you, Maxine. Maya, sorry, Maya, over to you.
No, I'm sorry, I too eager to respond. In terms of the South Africa, the question about South Africa and the child grant, it's a very interesting issue, and I think it's something that has not been really explored, because we automatically sort of assume that women are the providers and that they should access the program. So in terms of what are some of the strategies to redress that bias, I mean, one of the things I would sort of recommend is starting from a good gender analysis to actually understand what are the barriers to men having an interest in actually participating in the program. So what are some of the barriers, gender norms, and also some practical barriers in terms of time and the work engagement, prevent them from actually accessing the benefits. Another aspect could be about sensitization and actually sharing and sending out the messages that it's fine for men to participate and take on this primary caretaker role. And also another message about the importance of shared responsibility, which is what we spoke. I think will not sort of reduce the space for women's empowerment, but can actually harness and enhance it. So those would be some of the ways of actually addressing that issue. In terms of this interesting question about unconditional care as being framed as paying women for their caretaker responsibility, there is nothing official that came up in the literature reviews that I have done before, except this example in Ecuador, where President Correa was very sort of keen to sort of formally and very explicitly kind of define the access to bono, to the transfer, as something that it's remunerating women for their role in the provision of care. And that seemed to be sort of interesting. But both husbands and the community kind of reacted interestingly to this proposition. Not everybody was supporting that. But on a positive note, I think it sort of legitimized and kind of opened the space for women to be seen as productive and economic actors, and then to also make the claims for complementary measures that could be supporting their economic empowerment. So it was, it's an interesting example. And I think you can find out more about this in Maxine's qualitative study, her research on conditional cash transfers and gender in Peru, Bolivia, and Ecuador, which documented some of this. In terms of the intra-household dynamics, I think that programs need to pay attention to how these changes in balance of power and changes in women's status, what sort of impacts they have on individual members, both positively and negatively. And I think two strategies can be used. One, again, is sensitization and messaging, sort of explaining to beneficiaries, explaining to them sort of what this household entitlement entails and why is it provided to women. And I think in Lesotho there is an example of in the cash child grants program, which uses sensitization events to promote sort of understanding between husbands and wives on how the household entitlement was calculated, and to sort of send these messages to encourage wives to share their benefits with husbands to minimize the risks of intra-household tensions. And I think there is training on this, as I mentioned, in Bolsa Familia, which has partnered with Promundo, and they have developed some interesting training tools that they apply in their community meetings with beneficiaries when they engage very directly with men and boys in promoting the importance of gender equality. And again, I can share the resource, and I can share the links to these resources for whoever is interested. I think that covers it from my end. Thank you.
Thank you, Maya. Pamela, over to you.
Okay, thank you. Yeah, I agree with the others. I sensitization is a real entry point for all these questions, but I'm not sure if that's enough. So I would advise that sensitization, for example, with South Africa, or you know, how does a project target women without creating tensions in the household? All this requires great sensitization and discussion. I think stories from role models, like in the South Africa case, those men that are, you know, the uptake from men in those households who are also assuming responsibility of caretaking, their stories and they themselves, I think it would be very, very valuable if they could themselves come speak out. You know, they're part of the sensitization campaign, because, you know, people listen, villagers, or, you know, people listen to each other, and their stories really resonate with each other. So, you know, all the training or sensitization, it can only go so far. So the role models and the discussions amongst themselves to facilitate that, I think, would be useful. And also, I think, again, my value of the benefits of local committees and the program's local structures. I think they have a very important and potentially extremely influential role on these norms, on the way households actually benefit from programs, and who benefits, and certainly with the gender dimension. So the local committees could be very much part of that sensitization, but also take it further through household visits and sort of discussions with individuals and with households. I just want to mention if I'm understanding the question about the households and the women being paid for through unconditional cash transfers for the care work that they're doing in the households. I'm not sure, that doesn't really resonate well with me, but I think if an unconditional cash transfer program provided other skills training or linked with other income generating activities, and then the unconditional cash transfer could help pay for childcare or caring caring responsibilities, then I find that's a little more interesting, because that kind of is embedded in the whole poverty reduction and graduation strategy. So that could be very interesting. I leave it there.
Thank you very much, Pamela. For finalizing now, I would just like to direct two final questions. Regarding the social accountability aspect that was mentioned in Maxime's presentation, how can these participation tools be designed in a more gender-sensitive way, taking into account gender norms and women's time and economic constraints? And for Pamela and Maxine, could you please expand on the issue of political commitment? Could you please provide some guidelines on the kind of questions you ask to access gender dynamics? Do you think it's important to have male as well as female researchers on gender dynamics and issues? Maxine, over to you.
Thank you very much. Yes, I think on the question of social accountability, how do we make it in such a way, how do we design these mechanisms so that they don't put women off? I gave some examples, I think, in the talk about how you might, for example, be able to maybe pay women for their transport costs if they're involved in getting to meetings, having women-only groups who can discuss among themselves first about some of the issues that they are concerned about, so that they're not individualized and left vulnerable by speaking out on their own. We have to understand that sometimes these criticisms are of people who are very close to them, administrators of the program who exert a certain amount of status and authority at village level or local level. So it's actually quite difficult sometimes to reassure women that they have a right to express their concerns, and in such a way that they get the support of the community and other women for making these kinds of issues with a view to improving the program. So in a constructive spirit, that these things will help the program achieve its objectives better. But things like building women's confidence so that they can do this is a major step, and also ensuring that the practical issues like childcare, like travel, like time burdens are taken into account when these mechanisms are put in place. Sometimes you get, for example, some success with certain kinds of phone systems where women can be representative in a group sense, and then phone in and make their statements without having to travel. But of course that's open to all kinds of problems, because actually you still have to meet to make these decisions together. You still have to have a representative and so forth. And some programs have that, others don't. But it seems to me that there is some work to be done to provide the conditions under which women are empowered enough, if you like, to be able to have a role in program design. And equally, on the administrative side, training has to be given to make sure that people supporting these programs encourage women, that they don't see it as a threat, they see it as a way of gaining a much better hold over the way the program works, making it work more efficiently, and so on. As far as political commitment is concerned, the second question, I understand this to be about I'm not quite sure what level political commitment is mentioned. Perhaps Pamela mentioned some of this in regard to, at the highest level, getting ministries and individuals who have particular responsibilities to be attendant to the needs and expressed wishes of the people who are the direct beneficiaries of these programs. You have to work on these different levels, as we all know. It doesn't just stop at one level. It's a broader issue of sensitization, and it's a broader issue of bringing people into the conversation about how to improve programs. And I think as to the question of whether to involve men and women in research, of course, I think many of us have worked with both men and women in teams. But you know, when we were dealing with sensitivity around indigenous women in the Andean highlands in the project that Maya mentioned, we did have to meet with the women as women, and the researchers were all women, partly because these issues were pretty sensitive when they were discussed in that community. So again, context matters, it depends, and but it's generally a good thing to have men and women involved in issues of design. Otherwise we won't be able to change men's attitudes either, and things will go on much the same as they were before. So the key issue is who has the authority in such discussions, and it's desirable that women with gender training and with gender awareness have the authority to be able to establish some clear guidelines that are going to result in women being properly treated and their needs addressed satisfactorily.
Thank you, Maxine. I'm afraid we're running a bit out of time. So Pamela, for the last comments on these two questions, over to you.
Okay, thank you. For the political commitment, I could say that, you know, it's sort of a multi-pronged approach. Champions throughout the vertical layers. Definitely at central level, usually out of ministries. You may have national strategies. You may have required action plans nationally to be cross-cutting in terms of gender-sensitive programs. You also may have agencies, institutional arrangements, maybe established in terms, and that reflects political commitment. Agencies such as a gender agency, or to assume responsibility for the accountability of gender mainstreaming throughout national programs and projects and such. So that's also a possibility. Then, of course, the monitoring evaluation system, that could even be embedded in larger macro sort of national programs, like a poverty reduction program or such. But that requires reporting and based on action evidence of gender mainstreaming and improvement in women's economic empowerment. So that's another form of a reflection of a demonstrated commitment to gender-sensitive programming. Then I want to mention that also at local level, it's very, very important. So it's not just these central national levels, but commitment out of local authorities and champions. And that's hard to foster and to nurture, but it exists. And when you get that kind of commitment, you really get the push to make a lot of these big claims and agreements and assertions actually in practice implemented. So that also is something to foster and nurture. So commitment comes in different forms, at different levels, and it can be promoted through different mechanisms. In terms of the research team, as Maxine also responded, of course. In fact, one of our requirements in all of the qualitative research that we undertake, it is a gender balance in the team. This is without doubt. And whether we're talking, whatever subject area we're developing or probing into, it's critical to have both men and women, both not only to do on the team in terms of the questioning and the meeting the informants. which we like to have a mixed team, a man and female together, working together at the very detailed, in-depth level, but also in analysis. When the team comes together and is looking at the data collected for the day, it's very, very helpful to have both men and women, different perspectives. You know, it kind of brings together different points of views, and it's very enriching. So I would highly recommend in doing any kind of qualitative work, and especially if it's gender sensitive work, given the constraints that Maxine said of the cultural and full respect of cultural context, it is very beneficial to have a gender balanced team. Over to you.
Thank you, Pamela. And I think that's a wrap. We are running a bit out of time. So thank you to Maxine, Maya, and Pamela for their great interventions. And thank you to all the participants who joined us today. The questions that have not been addressed during the session will be addressed in written format and posted at the online community, where all the slides and recordings, including of this session, will be available. So thank you all.